Welcome to Live with Hillsdale Hospital. Today is Thursday, February 27th.
Wow.
Spring's what? 3-4 weeks away?
I
March
hope
20th
so. Yeah.
is spring. That's the first day of spring. And a very good day because I will be turning 51. Isn't that hard to
Wonderful.
believe? March 20th. So I'm looking forward to spring and not my birthday. However, today we're here to talk about some very exciting things that are happening in your world.
Yeah.
We're going to talk a little bit about what's happening in our clinics, and I'm just excited to let our community have just an insight into a little bit about who you are as a provider and then what you're doing to help expand primary care services right here in Hillsdale. So we come to you live today to update you on what's happening here at Hillsdale County as it relates to healthcare and your healthcare needs. As always, at the end of this session, we do provide an opportunity for questions, and you can actually do that throughout as we're talking. Write your question down. One of our engineers will get that question and will ask us at the end of the program if there are any questions. They'll give us the question and we'll try to answer it to the best of our ability. If we can't, we will. We want to make sure the information is accurate. We will make sure that we get a response back to you. So please feel free, comment as you're listening. So here I am joined by an absolute beautiful addition to Hillsdale Hospital for advancing primary care, Dr. Mewes. Welcome.
You,
is this your first?
This is my first.
Live. I know that we've had a lot of conversations about you, but never in the studio with you.
Correct.
And now you get to tell our listeners about yourself and what you're doing here at Hillsdale Hospital. So let's start there. You know, I know you. I know your background. We had the privilege of being able to get you from another place, and we were the benefactors of that. And Dr. Mewes, you've done a remarkable job here at Hillsdale, and you've carried the torch that was passed by Dr. Bennett, and you've had the ability to take a little bit further, expanding the role of primary care. We purchased some additional practices, and you've been integrating those practices in.
Yeah.
And so I want our audience and our listeners to know a little bit about you and your background. So why don't we start there? You know, tell them a little bit about your background, what you've been doing, and then we'll get into what your role is here at Hillsdale.
Yeah. So, starting out, I'm originally from the area. I am a graduate of Reading High School.
Nice.
I then went on
Go Rangers,
yeah,
right?
Go Rangers.
Okay.
I then went on to Hillsdale College before
Nice.
I did 4 years there, ran cross country and track as well. And then.
So what was your major at Hillsdale College?
I was a biology major.
Biology makes sense. All right. And did you always know from the beginning, like, I want to be a doctor?
Yeah, I
You did?
actually, when I lived in California before we moved here, I was in a pre-medical academy, kind of, set the tone for where I wanted to take things.
Really?
Kind of always knowing that.
Was that post-graduation or pre?
That was pre, so I was my freshman and sophomore years of high school.
Oh, high school.
They started all of that. And
so you did like a certified nurse's aid training or anything of that nature?
Yeah, we did some of that. We did some like candy striping volunteer in the hospital.
Candy striper. I have not heard that term in a long time.
Yeah. So kind of testing the waters in healthcare, and that's just kind of for my passion for taking care of people.
So you complete Hillsdale College, and then what happens?
Then I went to Michigan State for medical school. Graduated from there. I actually came back to this area about 8 years ago. And I did a traditional osteopathic intern year. Kind of got a feel for the community. Went on to finish.
And you were in, I think, peds. You did primary care, specialty care, maybe?
Yep. We do a lot of that the first year that you're in residency.
With Dr. McCants?
I did not get out to his office. I did some with general surgery.
General surgery.
We did anesthesia.
Pain? You did pain?
We did not have pain at that point.
Okay, all right. So but you did anesthesia.
Yep.
Yeah. I remember Andy Bigner. So you work through all of that, and then you go away. You leave our community. Which saddens us, And then what did you do during that period?
So I finished residency in Garden City. And then I continued to practice.
Community Access Hospital, or what was it?
It was a traditional, used to be osteopathic general hospital.
All right, just acute care.
Very much a community-based hospital. A little bit bigger than ours, but not a whole lot.
Sure. So you have the experience of rural, smaller.
Exactly. And then from there, I went into private practice in the Metro Detroit area.
Oh, wow.
And was in practice for about 5 years up there.
Yeah. So Metro Detroit, you're doing all kinds of care, right?
All kinds of care.
So so the type of care that you were doing before we get into what you do at Hillsdale, you were seeing diverse patient panel,
Yep.
right? Endocrinology,
Mm-hmm.
Treating heart,
Yep.
treating even some, I would say, COPD.
Yep. A lot of COPD.
So it was a community clinic,
Mm-hmm.
quite, from what I understand, quite a big patient panel.
Yes.
And there were 5 of you, right?
At least
physicians.
Yeah, there was towards the end even more.
Was there really?
Yeah, yeah.
So very large practice. Did you do any hospital rotations or work as part of that? You did.
I would do outpatient and inpatient medicine a lot of times in the same day.
Okay.
And then I was also the head medical doctor at an inpatient psychiatric facility.
Psychiatric. Nice.
Yeah, so kind of did the medical management out there, but gave me a very strong background and comfort level with dealing with mental health and taking care of my patients in office.
And you see that bleed over into primary care because a lot of communities do not have, like we do, that we have a psych center. A lot of them don't have that.
Yeah,
and so you're managing those cases as primary care. And that can be difficult. Now we're pretty blessed here. We have Rihanna, nurse practitioner, who does a phenomenal job. And then we have Sarah Butler, nurse practitioner, who also does a great job on both the inpatient and outpatient. Rihanna's outpatient. We're blessed as a community to have that and to have 2 psychiatrists, 1 full-time and then coverage, and then an inpatient unit. But you're managing those. So before we talk about what you're managing at Hillsdale, you're a medical director, you know, and I appointed you the medical director of all of our primary care practices. It's a huge responsibility. You have a lot of providers that report up to you, and you set a clinical acumen. You know, you have a business acumen and a clinical acumen, and we appreciate all that you've done on both sides of that. But why don't you tell our listeners a little bit about what does a medical director do, and what do you do from a day-to-day basis? Because you're also in the field. Talk to us a little bit about that, if you would.
Yeah, so, you know, part of this role is I have the very unique privilege of being able to take care of this community and to kind of hear the voice of the people that we take care of. And so sometimes we see a disconnect in some of these larger systems where you have, you know, your doctor that you go and you see, but then, you know, there's issues with logistics of how do I get in for this test? How do I do that? So to have somebody that can kind of navigate now on the administrative side as well of how can I help facilitate with our colleagues in pulmonology, with our colleagues in cardiology or pain management to help facilitate care for our patients. So really kind of making them the focus of this.
And for the blessing for your arrival is that you can help coordinate the care along our continuum. What that means is general surgery that we have. We have a neurosurgeon. We have a vascular surgeon. You know, we have orthopedics. You can now link those all together. And that speaks volumes. We're unlike a lot of rural hospitals, and you have to admit that. Because a lot of rural hospitals do not have what we have. And you've seen that, right? So you can tell our listeners that that's a real thing, that they don't have these type of services. But as we look at, you know, someone once told me primary care is primary care is primary care. That's not really true. Urban primary care looks a lot different than rural primary care, right? You're doing, you probably have done a few procedures in your office, correct? So talk to us a little bit about what makes it different in a urban versus a rural setting for primary care. What types of things do you see, and what types of things are you seeing now?
So, I mean, the biggest thing that everybody's going to hear a lot about right now is we've got a lot of the upper respiratory infections going on. I mean, that's been huge the last 3 weeks. We are starting to see a little bit of lessening, but that also stems from, you know, members of our community. You guys are trying to stay healthy, washing hands, trying to get in to see us whenever possible. In the clinic day to day, you know, we do procedures. You know, if there's an abscess that needs drained, I can do that in office. We do women's health. So any services related to routine gynecologic care, we help our patients with that. All kinds of different things.
And then coordinate from what you can do with the specialty care.
Exactly.
And I think that's an important piece to remember. Now, as a medical director, you know, you set that clinical acumen of what you want the practices to look like. So my question to you is, okay, what should the patient experience be? What can the patient expect when they come to our clinic? And what happens if they don't?
Right. So we are constantly working. I feel very fortunate. The crew of physicians and nurse practitioners and PAs that we are currently building. It's amazing.
It is.
This team, there's a real heart and passion for the community that I think has been having the right group of people come together at the right time to really improve access to patient care. Our big goal moving forward is to be able same day appointments. You know, we want to keep you guys out of high volume sick areas. So if there's something that we can do to try to get patients in for a same day visit instead of having to utilize the ER.
The most costly point in healthcare.
Exactly. And,
right now.
You know, when they have a dedicated appointment time, you know, a little bit easier to get you in and out with, you know, ER. Sometimes we don't know when you're going to be seen.
The
so
acuity of the patients, triaging.
So really trying to work on that. It's kind of an evolving process, and we're excited to see our availability really increase.
I would agree with you. We're starting to hear that. Now you have some new providers.
Yes.
And you're going to talk a little bit about who they are, where are our clinics, have that conversation.
Yeah, so we actually have 5 total clinics. We have the Reading clinic that's going to be out in Reading, and we have Hillsdale Health and Wellness.
And at Reading, I don't mean to interrupt you, but in Reading we have Sherry.
Yes.
And Sherry is a nurse practitioner. And then you also practice down there.
Yes, right? I'm in Reading 2 days a week. We're trying to, you know, one thing I want as the director is to have the pulse on each one of my clinics. And so things I can do to go out there and be physically present so I can understand what we need to be doing for our patients.
And you're seeing a lot of patients out there.
Yeah.
I mean, we're pushing through more than we've ever pushed through. You are and your team are doing a phenomenal job. And when I say team, you know, you got the front desk, you got your MAs, you know, everybody's, you know, going to watch out for Linehan. They know that she'll get them in and she is going to advocate for patients 110%.
Absolutely.
And we also have one full-time provider at all times.
Yes.
And then you go there. Any other providers going out there right now?
No.
Just the two of you.
Sherry and I right now.
So Sherry's a primary. So and that stability is good for patients, right?
Yes.
To know that I've got a provider who's always going to be there.
Exactly.
I think they're looking for that.
Between the two of us, we will share patients back and forth. If you know we have a patient that has an acute need that needs to get in, we'll look at our schedule sometimes and I'll be like, hey Sherry, I'm really busy. She's like, no problem, I have this. And I do the same for her. And
it's a great collegial relationship. So then let's transition up the road to Hillsdale, HHW, Hillsdale Health and Wellness. Primarily walk in on one side, primary care on the other side. Talk about the difference between the two.
So on our primary care, that's going to be very much your preventative scheduled same day appointments. So we have Rihanna, we have Scott, we have Jen that are all out there seeing patients. I'm also out there 2 days a week. And then on the walk-in side, we have Chris, and we have a couple casual NPs and PAs that will come in to help, especially when we get big waves of sickness like this. And so on the walk-in side, you know, they open at 10. We go from 10 to 6 and try to get patients in and taken care of.
So let's talk a little bit about, you know, we've had some periodic conversations with the community about the rise of RSV and the flu. My understanding is that we really reached a height at the end of last week, beginning of this week, but it seems to be going down a little bit on the inpatient side and ER. Are you seeing that correlation in the clinics or not?
We're seeing a little bit. Yeah, we're seeing it start to taper off a little bit, but still enough that we're cautious. We're still masking in clinic and making sure that we're taking all precautions to keep our patients healthy.
So if a patient is really, I mean, just absolutely ill, right? Has a difficulty and weakness even walking. Televirtual appointments are available.
Yes.
So that's an option. Do you do any, I know at one point during COVID, we would go actually and segregate them so that way they didn't have to be around other people. And we even would do phone consults. So what is the opinion now? What are you leaning more towards? The video?
It's going to be more video.
Okay.
Unfortunately, we're seeing a lot of insurance denials. So that's another thing as a director, trying to protect our patients from getting stuck with unnecessary bills because the insurance isn't picking it up. And, you know, just making sure that you're getting the best care. I mean, part of what we do, there's an art to having a human physically in front of you. And that just nature of being able to touch somebody and examine them that we do. But in situations where we're having trouble getting patients in, absolutely video visit.
The video. Would they just call the office like they normally would for an appointment?
Yes, they would.
Okay.
There's a little bit of kind of technical jargon.
Make sure they can connect.
Yeah, making sure. And my front office staff at all locations has been really good at helping get that set up. They look at me, they're like, "Oh, do you want a video?" And I'm like,
exactly.
If you set it up,
say, I'll do it.
I'll turn on the computer. Let's go.
Yeah.
So.
All right. Well, let's move further. Now we got Hillsdale Medical Associates.
Yes.
Talk to us. We got some changes there.
We do.
We just hired and announced a new appointment.
Yes.
And so why don't you talk to us in the community about what's happening there?
So Hillsdale Medical Associates is the newest member of our family and kind of working out as we transition over. We have Dr. McCants out there. We also have Dr. Baker.
Yeah.
And then our newest hires, we have Patty Wise, PA.
Yeah.
I've heard really great things about her.
I get a lot of comments. Very positive.
Yeah.
Yeah.
And then our newest member of the team is Brandon Douglas.
A local kid.
Yes.
Jerome, Michigan, I believe.
Yeah.
So it's just here in Hillsdale County. It's so encouraging to see you. Then we look at Dr. Spencer, Dr. Odell, and just, these folks who've come back to their community. And I was recently speaking at a conference, and one of my colleagues was talking about how no one's coming back to their community to provide medical services. And we're blessed when you think about all of the folks that have come home. I think it's pretty exciting. So you have Brandon, who's come back home.
Yep.
And he's dealing with primary care.
Yes.
Okay, so primary care. Walk-in appointments at HMA available. They try to make room for the sickest.
Yes.
But obviously schedule your appointment. So then we have another clinic. Let's go down the road to Three Meadows.
Yes.
Dr. Kirsch.
So we have Dr. Kirsch out there, and he is doing a wonderful job, both in our community and some partnerships through the college. He sees all ages. So I know this time of year, sometimes trying to get in, he's great at accommodating that as well.
He is.
And again, another provider that will see newborn on up.
Yeah.
So
wide range for us, in a wide range. Let's talk a little bit before we talk about what, the patient experience. Let's talk a little bit about, all right, we lost Dr. Boachi. Now, you never met him, did you?
I did. We had about a 6-week overlap.
Oh, was there? Okay. All right. So endocrinologist, right? And there's a misunderstanding, I would say, that we can't do endocrinology type work, but we do, because you do. And others do that as well. Talk to us a little bit about, can you manage my diabetes?
Absolutely.
Okay.
So there is a lot, with the advent of, we're seeing new technology come to play. So insulin pumps, we're seeing new diabetic medications. Part of where I practiced before, primary care was very much all encompassing. I very rarely referred to specialists, especially for endocrine related issues. There's a lot that we
just
can
managed
do.
it.
Yeah.
Yeah.
And we're always happy that if that's somewhere that our patients need to go to facilitate that. But there's a lot that can be done on the primary care front.
Okay.
The biggest thing that would bother me as a provider is hearing my patients say, okay, well, I go to see a doctor and then they send me to this one and they send me to this one. So
I'll go to 5 different people and still my primary care.
Exactly. So kind of being that all encompassing, I kind of refer it as the head cook in the kitchen of, we want to make sure that you're being taken care of, that you have an outlet to go to. Right. And
and I think you've done a fantastic job at providing that depth. And we shouldn't have patients traveling. No. Unless it's to go see a cardiologist. I mean, we can do everything here at Hillsdale Hospital. And so endocrinology, if you have an endocrinology need, we can serve that need. And you've done that. You've taken on quite a bit of that panel. And so we just encourage our listeners that if they do have a need for endocrinology, you and your team can deliver that as well.
Yes, absolutely.
Am I forgetting any other practices?
Yeah, we have Dr. Shaw.
Oh, geez, there it is. Yeah. I always associate him with HMA.
You're
right.
Packaged deal.
Yeah, you're right. So talk to us a little bit about his practice and where that is.
So that is on Broad Street.
Yep.
And he is doing an awesome job out there. Again, another one of our clinicians that sees newborn on up.
Yeah.
Really good access. I've heard a lot
Always
of good
busy.
things. Yes.
Yeah. Takes his time with his patients. Builds a relationship. That's important. And the good news is we just renovated that building on the
I
inside.
haven't been out there to
Looks
see
very
it
nice.
yet.
Looks very nice. So you've got, a new Hillsdale Hospital look out there, and with the same level of care that Dr. Shaw has been providing.
Yeah.
And do you get out there much, or?
I'm slowly making my way.
Good.
Yeah.
Good. And then he does all primary care
Mm-hmm.
and very busy practice.
Yes.
I think no nurse practitioners out there. It's just him, right?
Just him.
And so let's kind of conclude our conversation today with talking about your vision for primary care, because primary care is shifting, right? It's changing. And I think in part because as you see rural communities, your primary care physician is pretty much responsible now for managing everything.
Yeah.
Now we're a little different because we do have vascular and we have urology. And so you do have accessibility to send them just 2 miles up the road.
Exactly.
But what is your vision for primary care? What would you say you're going to set out to do for the future of primary care in Hillsdale?
So really my biggest vision is I went on to specialize in family practice because I love the aspect of being able to take care of newborn on up. I love getting to know entire families. Those are things that I've incorporated into my practice before and kind of expanding that through all of our primary care and increasing our access.
Right.
I want you guys to feel like you have a provider that is here and present for you, that they're always listening to you and able to meet your needs.
Absolutely. And you've done a great job so far, but I know that you have a lot of plans for the future. And as you build your team, you know, it's incredible to see some of these new providers come in. They have the energy, the passion, the drive to take care of our patients. And that's really what's needed. And so thank you, Dr. Mewes, for the great job you've done so far. We're only getting started. There's a lot of great things that are happening, great announcements coming in the future, some other exciting partnerships and opportunities to expand primary care right here in Hillsdale County. So thank you for joining us today.
Thank you for
Before we close, we're going to ask, are there any questions? You have answered all of the questions. If you're viewing this after the live, feel free, put a question in the comment box. We'll be more than glad to answer your question. If it's beyond my scope or the person answering, we're going to fire the question right off to Dr. Mewes. If it's a specialty question, we're going to get that right over to the specialist. Please let this be an interactive conversation between Hillsdale Hospital and you. We're here. You've heard. We can take care of all of your primary care needs. We have appointments available. Access is improving. Hiring new providers. Great opportunity for you and your family to receive high quality care, low cost, in an environment where we have a full continuum. So if you need those referral services, we're doing it outside of brain surgery and heart surgery. We're doing it here at Hillsdale Hospital. It's very exciting, isn't it? It is. All right. So we want to thank you, Dr. Mewes. We want to thank your team. None of this is possible without a great team.
Absolutely.
Right? Leadership of Seth Gibson as our director of the clinics. Your leadership as a medical director. You kind of have this, dual role that you play because you're not only the medical director, but you're out delivering services. And I think you're always going to do that, aren't you?
Yeah. Absolutely.
You want to be at the bedside, as we call it, or at the view side. So it's great to have you on the program today. I know you're going to do great things in the clinic to continue. I'd like to have you back on in the future.
Absolutely.
Maybe talk about some of the great things that are happening and that we're pursuing. Until then, we would encourage our community to watch out for the flu, right? Hopefully it begins to diminish a little bit, but take precautions, wash your hands, don't touch your face, make sure that if you're not feeling well, don't go in big crowds, all the common sense stuff, right? If you're not feeling well, you can go in to see one of our providers. If you're beyond that, because you just don't want to go in, there are televisits optional. You can call the respective clinic where your primary care provider practices, ask for a virtual visit, and they will set that up, correct?
Yes.
Okay. All right. Well, thanks for joining us today. We appreciate your time as our listeners. It's your trust in us that creates this environment that allows us to be able to deliver the services that we deliver and the depth of those services. We'd encourage you to continue to use Hillsdale. When you place Hillsdale first, we are Hillsdale strong. So I look forward to seeing you back here next week. You can hear programs like this every week. Also on the radio every Friday, 92.1. We're going to be talking about issues that we address right here in this room to give you the what's happening in healthcare at Hillsdale County. And of course, other ways to connect with us on our Facebook, on our website, hillsdalehospital.com. You want to join an award-winning team, you can do that. You can go right to our website under career tab. You'll see all the job postings. We'd love to have you part of the team. Also, if you want to volunteer, great place to volunteer, plenty of opportunities. And then if you're saying, you know what, I want my child to get a scholarship, that program right now, you can still apply for scholarships, high school seniors, Hillsdale County. If you want to become a nurse, go to our website. There is an application you can download and you can fill that out, get some letters of recommendation, get selected, come in for an interview, and we could pay up to $50,000 towards your education. That is incredible. And then you come back here to a job right here at Hillsdale Hospital. So tune in on 92.1 tomorrow on Friday. Also on Saturdays, we're on Buzz 102.5. Opportunities to have the same kind of conversations as we're having here on our radio program. Till then, stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us today.